Today, I want to give folks an update on the virus in Virginia, our vaccination progress, and our plans to get children back into the classrooms. First, January was a hard month for COVID cases. We saw record numbers of cases, hospitalizations, and sadly, deaths. But those numbers are all trending down, and that is something that we can all be glad about. I'd like to show you some of the numbers that we have been tracking. This shows you how our case counts are now finally turning the curve and trending back downward. And this next slide shows you the percent of people getting tested whose tests are positive. That's also trending downward. Hospitalizations are also going down, which is a very good thing. I know that all of our nurses, doctors, and everyone working in COVID units around the state are exhausted, and anything that lessens their burden is good. While these are all positive trends, we cannot let down our guard. The virus, as you have heard, is mutating and changing. The variant of the virus from the UK is here. We've had 4 positive cases identified so far in Virginia. And yesterday, unfortunately, the private lab company LabCorp identified the first case of the South African variant right here in Virginia. Scientists tell us these variants of the virus are even more contagious than before. In Israel, for example, the new variants account for more than 80% of the cases in a country that is about the same size of Virginia. These variants make it even more urgent to get as many people vaccinated as we can, as quickly and as equitably as possible. So now is not the time to relax. It's the time to get even more serious about hand washing, mask wearing, and physical distancing. That's why we made some changes to our vaccination plan last week that are already bearing fruit. We adjusted our inventory management plans. We worked with hospitals that had second doses they couldn't use yet and shifted those doses to get them in the arms of vulnerable Virginians. We gave our local health departments clear direction about how to prioritize the people eligible for shots in Phase 1B. We emphasized that frontline workers should be vaccinated in the priority we laid out in the guidelines, along with people with high-risk medical conditions. And we said that roughly half of the vaccines in each local health district should go to people aged 65 and older. And finally, we rebuilt our data dashboard to be more transparent and revised our data reporting schedule to better align with the CDC's. All of those changes are letting us put more shots into Virginians' arms faster, and the dashboard shows us that. I'd like to show you a couple of data points that show the difference that these changes are making. As you can see, we're pushing vaccines out as fast as possible. We've administered 86% of our first doses and 67% of our total doses. That puts us 12th among other states. And over 9% of our population has received at least the first dose of vaccine. That's 9th among states. We expect to pass 1 million doses administered this weekend. That's more than double the total positive COVID cases we've had since our first case on March the 7th. I also want to give you an idea of what this looks like on the ground. Here you can see where the vaccine has been distributed since the beginning of the rollout. Right now, this still reflects that the first waves of vaccine distribution went largely to areas with large health districts, health systems. That makes sense because the first wave was to reach our healthcare workers. And here we can see the rate of vaccination in each district. As you can see, the Southwest region has a higher vaccination rate than many of our populous areas. Places like Wise and Dickinson counties, Bristol, or Bland County. That's good to see, and it's a testament to the hard work of the health districts and health systems in our Southwest. That region was particularly hard hit toward the end of the year, with serious concerns about hospital bed space, and the population tends to be older and to have more health conditions. But of course, there are vulnerable communities across every part of Virginia, and they all need vaccinations. And we still have a long way to go. I don't want to sugarcoat that, because I know everyone is feeling impatient. It's hard to know that you are eligible for a vaccine, but no doses are available yet. But that's the situation we're in across the country. Demand is much larger than our supply. Every state, and I can promise you I talk to our governors frequently, every state wants more vaccine from the federal government. We can't make it ourselves. So I'm confident, however, that we're ready when that supply increases. And more vaccines are in the pipeline for federal approval, which will help. We saw our supply tick up a little this week as Virginia received 23% more doses this week than it did before. It's still not a huge jump, but it's a step in the right direction. We talked last week about frustration, about how to sign up. I have an update on how we're improving that. Most importantly, we are significantly expanding our call center. Starting tomorrow, we'll begin training 750 new call center workers. That will be complete within a week. Wherever you are in Virginia, you'll be able to call this call center to get information and pre-register if you're eligible for vaccination. The phone line will then go live and will be available in English and in Spanish. You can also request a call back in one of 60 other languages. So I want to reassure everyone, if you've already pre-registered through your local health district, you do not need to pre-register again. You're already in the system. The call center, as well as a statewide online registration system that is coming soon, will all feed into the same pre-registration database. The information will be shared with your local health districts. And right now, all local health districts have clear information on their websites about vaccine eligibility and how people can pre-register online or by phone. I also want to share some other good news. The federal government will soon start shipping additional doses to certain pharmacies. This week, the Biden administration announced the next phase of the federal pharmacy partnership. In Virginia, CVS will be the first pharmacy in this rollout because it has the most locations of any pharmacy in Virginia. We have worked with CVS to start with their stores that are within reach of people who are more vulnerable, those age 65 and up, those who are of low income, and those from disadvantaged communities. CVS is starting with 36 locations sometime late next week. These vaccine doses are in addition to those the state is receiving. We're still working with CVS and CDC on how registration for those vaccinations will work. So please stay tuned. And be assured, this is only the first phase of the rollout of the federal pharmacy partnership. We're working with other pharmacy chains such as Walmart, Walgreens, and Kroger. Our health department has worked closely with the CDC to make sure this partnership covers as much of Virginia and as many vulnerable Virginians as possible. This is also in addition to the Virginia Department of Health's work with independent pharmacies. Here you can see a map of vaccination sites around the state, and there will be more to come. Now, I'd like to turn to an issue I know at the top of the minds of families across our Commonwealth. That is how we get our children back into the classroom. I'm also pleased to tell you that the legislators are making this a top priority. I'm pleased to have Senator Chap Peterson with us today. Chap, thank you so much for all of your work and all of the other legislators as well. It is a top priority for everyone. When the pandemic started, believe it or not, 11 months ago, schools around the country closed. As school divisions began developing plans for the current school year, our guidance to them was that we want students and we wanted our teachers and the staff to be safe. But we encouraged in-person instruction for the students who needed it the most. When school divisions were planning this school year, there was a lot of uncertainty. There were no simple or easy decisions, not for school administrators, teachers, or parents. But we've seen more data now, and it suggests that schools don't have the kind of rapid spread that we've seen in some other congregate settings. That tells us it's time to find a path forward to in-person learning. In the past 11 months, our children have been champions. They have made sacrifices. They've endured a lot of change and uncertainty. And so have their families and teachers and school staff. But we know that this has taken a toll on our children and our families. So my fellow pediatricians say they're seeing increases in behavioral problems, mental health issues, and even increases in substance abuse among their young patients. They're writing more prescriptions, such as antidepressants and stimulants, and that's just not a good direction for us to keep going. And we're also seeing a decline in academic performance. I know this has been hard on everyone. It has been a school year like no other. It's been hard on children, and it's been hard on our teachers. But we also know this plain fact: children learn better in classrooms, and that's where they need to be. Last month, we issued guidance to our school divisions for how to plan a safe return to in-person learning. We didn't say, throw open the doors 5 days a week starting tomorrow. We said, here are the steps that you need to take. You can start with the students who most need that in-person instruction. But we also said, this needs to happen. And today I'm saying it needs to start by March the 15th. By that date, I expect every school division to make in-person learning options available in accordance with the guidance. They also need to plan for summer school options. This won't be mandatory, but it definitely needs to be an option. Our children need to catch up to be ready for learning in the fall. I want our schools to do this safely, and I want them to prioritize students who need this the most. The guidance lays out the steps for schools to take and the safety precautions that make it possible. But it's time for this to happen. It's critical to prevent greater learning loss and to support our children's health and well-being. The CDC, which updated its guidance last week, say it's possible to do this safely. Dr. Fauci has said it's possible to do this safely. President Biden has said it's possible to do this safely, and we will do it safely. And the experience of school divisions across the state shows us that it's possible to have in-person learning safely. Daycare centers and early childhood educators have demonstrated this throughout the year. We know the right things to do, requiring masks, keeping desks further apart, and more. We have prioritized vaccinating our teachers. We have given school divisions the funding that they need for safety measures. In-person learning won't look the same for every school division, and it won't look the same as school did a year ago before this pandemic began. But we need to make a start. We can do this, and we must do this. I want to take this opportunity to really thank our teachers who have been heroes throughout this time. Teachers always give a great deal of themselves to their students, but they've gone above and beyond these past 11 months. Many have been teaching in person this whole time, and many others have navigated a new world of virtual learning. They all deserve our thanks. Now, this is exciting. I'd like to introduce Virginia's 2021 Teacher of the Year, Anthony Swan. Anthony teaches the 5th grade, and I told him earlier this was one of my favorite grades, at Rocky Mount Elementary School in Franklin County. Today, I'm appointing him to the State Board of Education. He is a fantastic teacher and a tremendous mentor to his students. Anthony understands what this year has been like for students and for teachers. So please join me in welcoming Anthony Swan. Anthony, welcome.
Thank you, Governor. It is an honor and a privilege to be able to serve as the State Teacher of the Year for the year of 2021. It's an honor and a privilege to be one of the newly appointed members of the Board of Education. I'd just like to reiterate what the Governor has said. Our students need some form of in-person instruction. As a current classroom teacher, I am on the front lines of education, all while serving children during a pandemic. I know the importance of safety, but I also know the importance of our students' education. Let's face it, although some students are all virtual, they still don't have true accountability measures in place to ensure that they are learning. For instance, when my district was following a hybrid learning style, I found that when a lot of my students were at home on virtual days, they would not do the work. Once they returned to school, I had to play catch up with them instead of being able to move forward with instruction and curriculum. Our students need in-person instruction. Not only will in-person instruction help them academically, but it will also help our students with their social and emotional needs. For instance, just last week, my district, Franklin County Public Schools, was able to bring back all of our PK through 7th graders into the building 4 days a week with the proper health screenings and mitigations in place. On the very first day with all my students back, one of my students walked in the room, and his words, and I'm going to demonstrate how he reacted. He walked in the room, and his very first words, "Oh my God, I get to see my friends." So as a teacher, I'm observing how he's reacting. That meant a lot. He was excited. Then he went on to say, "Mr. Swan, I know COVID is here, but I'm just so glad I get to see my friends." Virginia knows just how important it is to keep our students safe. That's why we as educators have been put as top priority to receive the vaccination for COVID-19. I just received mine on Wednesday. Many people are reluctant to take it, but I'll just leave you with this thought. Oftentimes we put in our bodies things we don't have a clue about, or things we know that will harm our bodies. For instance, when we eat fried chicken, the grease harms the heart. So a lot of times people are reluctant to take this vaccination. Why not take the proper things and safety precautions to keep our students safe? At least you know that the purpose is to save your life and not take it. I encourage all educators to get your vaccine so that we can serve all of our children in person in a safe manner. Thank you.
Thank you, Anthony, and I guess also as a pediatrician, thanks for the food advice. But, not that I like it, but I think that's good advice. But thanks so much for all you do, and congratulations on being on the Board of Education.
Thank you.
Yes. And finally, I want to talk about problems I've heard people are having receiving the latest unemployment benefits. The federal government extended unemployment benefits at the end of December. That came with some new eligibility rules that the Virginia Employment Commission had to work through, and new requirements for independent contractors and our gig workers. I know that some people still have not received these benefits, and they're frustrated. So many Virginians have lost jobs during this pandemic, and many people are still struggling. More than 1 million Virginians have received unemployment in the past 11 months, amounting to more than $10 billion. The Virginia Employment Commission has served more people in the past 10 months than it did in the previous 10 years combined. For many people, these benefits are critical, and we understand that. The Employment Commission expects to have the last piece of this program up and running by Tuesday, and more information will go out to people tonight. We also continue to work to get people back to work. Just yesterday, more than 13,000 Virginians signed up for a virtual career fair through the Virginia Career Work Centers. We'll continue to have local and statewide job fairs to help people get back to work and back on their feet. So in closing, I think a lot of encouraging news today. We have made great progress in our vaccine rollout, and we will continue to be flexible and make adjustments when we need to. I don't have to tell you, Virginia, that these vaccinations are critical. Just as Anthony said, I want everyone to be able to get it, and I'm doing everything in my power to make it easier for you to get the information you need and get vaccinated when your turn comes. The vaccine supply will increase in the coming weeks, and as it does, we'll get it into the arms as fast and as fairly as we can. My promise to you is that I will keep working to make improvements, to fix problems when we find them, and to move this effort forward. I, like just all of you, want to put this pandemic in the rearview mirror. As you have heard today, I, along with all of these folks and many others that are watching and working on this, we want our children to be back in school safely. We want our businesses to be back up and running. We want our economy to get back on track where it was prior to COVID-19. And together, we're going to keep working on this till we finally put this pandemic in the rearview mirror. So thank you.